Hello, I'm Anthony Sagnella, health and physical education teacher and head football coach at North Haven High School, the 2022 Class MM state champions.
And I'm Amanda Forcucci, Director of Health and Physical Education for Hamden Public Schools and head coach of the Hamden High School girls basketball team, the 2023 Class LL state champions.
The CIAC has partnered with Connecticut Department of Mental Health and Addiction Services to help inform athletes, parents, coaches, both new and established, as well as athletic directors and school leadership, how the effects of substance use will harm student athletes' performances.
As you know, there are many choices athletes, coaches, and families make every day that contribute to athletic success, like nutrition, sleep, work ethic, habits, and deciding how to handle substance use. We are not here to tell you what you can or can't do, but we would like to share some facts on alcohol and substance use so that you can make informed decisions and understand how they can impact your athletic season.
Did you know that human brains are not fully developed until the age of 25? For teens, this means that all substances have a longer lasting and greater impact in the body. The earlier you start using substances, the more likely your brain will become wired to crave that substance, which can lead to addiction. Research shows that people who start drinking before their brain is fully developed are at higher risk for developing alcohol use disorder later in life.
Alcohol is one of the most widely used substances by teens in Connecticut and is seen by many as a harmless rite of passage. However, there are harms, especially if those teens are athletes. Alcohol use leads to dehydration, decreased strength and endurance, more frequent injuries, and longer recovery times. There have been studies that show that one night of drinking can undo the positive health effects of 2 weeks of practice.
Vaping has increased in popularity among Connecticut teens in the last few years, with roughly 1 in 4 high schoolers reporting that they've vaped in the past. But this also means most Connecticut high schoolers have made the decision not to vape. Vaping can harm lung tissue and lead to other serious conditions like pneumonia and bronchitis. No matter what your sport is, it is crucial to be able to breathe efficiently in order to perform at your best, and vaping can disrupt that.
In Connecticut, marijuana use is legal for those over 21. However, this does not mean it is safe, particularly if they're athletes. In fact, marijuana can be addictive, especially for the developing teen brain. Even if you don't develop an addiction, there are still concerns. For instance, youth that consume marijuana are more likely to drop out of activities like sports, and they're even less likely to graduate. Marijuana can decrease motivation, impair judgment, and slow coordination, which are all things crucial to athletic success, not to mention the mental health risks. Studies show that marijuana use can increase anxiety and depression in teens, despite claims that marijuana has a calming effect.
We all know that pain comes with sports. We get comfortable with being uncomfortable, whether it's pushing through another drill in practice or walking off the pain from falling on the field or court. Serious injuries may require pain management under a doctor's care. And because anyone can be at risk for developing an addiction to opioids, taking them to treat pain may not be the best option. Talk openly with your doctor about other pain management strategies that may not necessarily have to include prescription opioids.
Getting pills from unregulated sources increases the risk that they may be contaminated with other harmful substances like fentanyl and xylazine. If it isn't directly from a prescriber or pharmacist, and even if you feel you are getting them from a trusted friend or dealer, there is a risk. Of the illegal pills that have been confiscated by Connecticut police, more than 60% have contained fentanyl.
What's more concerning is that the pills can be made to look like actual prescription medications, giving people the false belief that they will be safe to use. Even some marijuana purchased through the unregulated market has been found to contain fentanyl, perhaps being contaminated during the plant processing. Fentanyl has been present in over 80% of Connecticut's overdose fatalities and should be considered very dangerous.
Please see the following resources if you would like more information. I hope you have a memorable season and that this information supports your success.